The Philippine Nurses Association of Nevada now brings you FILPINARS, news and features about the Filipino-American nursing community and beyond. And now, here's your host, Doris Bauer.
Well, hello there, FILPINARS listeners and followers. Belated Happy Valentine's Day. Thank you very much for joining us again today. And as you know, FILPINARS is brought to us by the PNANV, or the Philippine Nursing Association of Nevada, in collaboration, of course, with PHLV Radio. We are here to bring you awareness of the different health and healthcare-related issues and challenges in our community and beyond. And then we hope that we can bring some solutions or suggestions to these challenges. So one of the challenges that is here in Nevada, especially affecting the Nevada elderly community, is the lack of resources to provide for hourly, live-in, and overnight home care services. So recently, Angel's Heart Homecare services opened their doors to provide us with such care. So let's see what they have to say. So with me here is Mr. Arsenio Tabla, the owner, and Ms. Jen Ko, our singing realtor, actually, who are very responsible for the opening of this facility. So welcome. So Mr. Arsenio, so what is your background?
Oh, my background is I've been a nurse for 30 years, way back in the Philippines. So I have a home health agency in California, one in Sacramento, one in San Jose, and I have one home care agency in also California, dealing with helping all the elderly clients who need some help. So we need the caregivers, we need the CNAs. So I think the industry right now is the home care industry right now is needed for nurses, caregivers, and CNAs. And I know in Las Vegas, Nevada right now is a shortage for all of the nurses, healthcare. Right. So if you are caregivers, CNAs, nurses, please contact us. Yes. Genco here. I have a brochures here. If you want to get some brochure, call Jen.
All right. So, Ms. Jen, okay, I know you're here in Vegas. So anyway, what prompted you to collaborate with Mr. Arsenio?
Well, thank you, Ate Doris, and of course, thank you, Kuya Yo, behind the camera, PHLV Radio, Ate Flora, who's right there behind to the scene. But anyway, everybody knows me as the singing realtor, Ate Jen Ko, bahay negotiator ba. But people didn't know that I was in the medical field before too. I was phlebotomist for 17 years. I went to LPN. It's just that I found out it's not for me for other reason that no. It's different. It's personal reason. I cannot handle it, or when it comes to hospital and whatnot. But my heart has always been in the medical industry because of my family. We have a lot of health issues. That's why we figure out, might as well have the agency or the facility that can go ahead and help not only my family but every Filipinos and other people here in Las Vegas.
That's very good. So can you let us know, it is Angel's Heart Home Care Services. What kind of services would you provide for your clients?
Okay, so I'm being put on the spot right here. Well, we take care of personal hygiene. We help on the patient and personal hygiene activities of daily living. Pretty much, we are a non-medical agency, so we don't give medications or anything like that. But we are simply a reminder to the patient that, hey, look, Miss so and so, it's time for you to drink your medical. We're just there to assist and help out on their daily activities.
Okay. And that is really, we have a big need for that here in our community. So I'm so glad that you have opened. I know that you're looking for people to service your clients. Mm-hmm. Okay, so you're looking for CNAs and patient caregivers. Mm-hmm. Okay, so they are looking, then they are hiring. So the address is 3430 East Flamingo Road, Suite 233 here in Las Vegas. And the phone number is 702-450-00 05. Okay. So, but one more thing that I need to ask you guys. How how would the clients pay for their services? Is it going to be all on a cash basis, or do you accept insurance?
Right now, this is a non-medical, so it's auto pay for the client. So they are not covered for Medicare, so the client will pay for all the services.
Okay. Very good.
May I add to that too, that if if a client purchased a long-term care insurance, private insurance of their own that connected to their life insurance or any insurance that they bought, then that is also acceptable. Correct.
Long term. Okay, so you heard all of that. Long term insurance is accepted. So, and what areas do you cover?
We cover pretty much Las Vegas, North Las Vegas, Pahrump, Summerlin, Henderson. Pretty much all over here, Clark County and all.
Okay. Well, very good. So thank you very much for being interviewed today, and hopefully this is a service that is actually needed in our community, and especially for the Filipino-American community here in the Las Vegas area. So this is an ever-increasing addition to the resources available to this community. So again, this is Angels Heart Home Care Services. They are located in 3430 East Flamingo Road, Suite 233, and that's Las Vegas, Nevada 89121. Telephone number 702-450-0005. Well, congratulations to Angels Heart Home Care Services. Well, everyone, we just celebrated Valentine's Day, and as we all know, Valentine's Day is a celebration of love. And as cheesy as that sounds, Valentine's Day is supposed to be a time for love when couples or people show kindness and affection to their loved ones through gifts, experiences, and special treatment. Today, on this episode of FILPINARS, we are going to bring you a different manifestation of love. That is, the love for our Filipino-American community. We have some special guests here who are healthcare professionals who will explain to us what's being done to help the Philam community through the FAPCOR Nayon project. So please welcome Dr. Danette Bloom, Maria Danette Bloom, zooming all the way from Texas, right, Dr. Bloom?
Yes, yes. Hello, everyone. Hello, all listeners of FILPINARS. Thank you so much to Doris for inviting me, as well as Elizabeth, the two Elizabeths of
yes.
Philippine Nurses Association of Nevada and Las Vegas as well. Thank you so much. FAPCOR stands for Filipino-American.
Hold on, Dr. Bloom. Let me introduce the other guests yet, and then we'll be asking you all those questions. Okay. All right.
Thank you, hon.
Oh, that's okay. Oh, yeah, and Johan too. Right. And our other guest is Dr. Elizabeth Files. Okay, Dr. Files, and another Elizabeth De Leon Gamboa. And Miss Lindsay May Ugali, correct?
Yes.
Okay, all right. Well, to start with Dr. Bloom, can you tell us a little bit about yourself?
Yes, I'm originally from the Philippines, of course, from Bohol. I completed my nursing degree in Cebu State College, which is now Cebu Normal University, and then I proceeded on to go to Australia, Sweden, England, and then the United States for my graduate degrees. And one of the things that I have learned as I progress through my career is that health of Asians, including Filipinos, are usually left out in discussions. So there's very limited research about Filipinos and Asians. When they're researched, they're lumped into a group. And so all those subgroup issues are being basically like when you average, they become out so healthy, but we have health issues. So I that really moved me a lot, and so I made it my part of my program with science to work on Filipino Americans and to bring about awareness, not only the Filipino community, but hopefully at the national level, so that we could have more research done among Filipinos and Filipino Americans.
Awesome. Awesome. Thank you, Dr. Bloom. Yeah, we look forward to, your projects. Okay. And Dr. Elizabeth Files is local here in Nevada. Well, who doesn't know Elizabeth Files?
Thank you, Doris. You're funny.
Go ahead and say something about yourself. Why don't you?
Well, just like Danette, I originated from Masbate in the Philippines. I speak Masbateño and Filipino and English, of course. So came to the States in 82. Started in New York City, found my darling there, moved to Chicago for 8 years, and then in Vegas for over 25 years now. So
Yeah.
I'm faculty at Chamberlain University.
Yes.
And so heavily engaged in community work.
Awesome.
Thank you.
Awesome. Okay. And of course, who doesn't know Ms. Elizabeth De Leon Gamboa, the immediate past president of the Philippine Nurses Association of Nevada. Welcome.
Hi, Doris. Thank you so much for having me. And it's an honor to be part of this amazing group of leaders spearheading this FAPCOR Nevada Nayon. So I'm also from the Philippines, proud Filipina, graduated from the University of the Philippines in 1991. And I'm very proud to say for 31 years, not just serving in the front lines of different healthcare facilities, but also in the community. And this is one of them. As an immediate past president of the Philippine Nurses Association of Nevada, I believe that the Filipino nurses have found their voice and have been out there, helping out during the pandemic and beyond. So this is one way to really serve our PhilAm community. And thank you so much for giving this opportunity to us to
Awesome.
showcase it.
Awesome. Thank you. And of course, last but not least is Miss Lindsay May Ugali. Lindsay, tell us about yourself.
Yes, I am originally from Hawaii, but my family previous to they're from the Philippines, from Kamiling, Tarlac. So we would actually go once a year all the way up until I graduated high school. I have been in Las Vegas now for about 15 years and hitting about my 10th year of nursing. Woo.
Wow.
Wow.
I'm currently a clinical nurse educator at the Valley Health System, and I work directly with my management team, including Rosemary Tuitt, who I was introduced to Dr. Fields to, and I'm thankful. She's truly a heaven sent, because even hitting the 10th year of nursing, I always wondered, how can I give back to not just my community, but to my fellow Filipino-Americans. So this is, again, an honor, just as Ate Lisa mentioned, and a truly exciting opportunity with what we're trying to spearhead.
Well, thank you, Lindsay. You're one of actually, you're the youngest one in this group, right? So we welcome young people. Yay. Okay, so we're going to talk today about the FAPCOR Nayon project. So the word Nayon in the Filipino language means village, township, or barangay. So the first few questions I have for this project is directed to Dr. Maria Danette Bloom. Dr. Bloom, what is FAPCOR Nayon? Why and how was it created?
Yes, thank you so much, Doris. So as mentioned earlier, I had noted that lack of attention to the healthcare needs of Asians, specifically Filipinos. So by way of that, I actually submitted a grant to the Patient-Centered Outcomes Research Institute. So the patient-centered, it's called PCORI. So it's kind of a unique mechanism that they have, because they actually fund projects which kind of build capacity and engage the populations on endeavors that would improve patient outcomes in that population. So I got funded by the PCORI, and this is the FAPCOR. It stands for the Filipino-American Patient-Centered Outcomes Research. And so initially, the funding was given to me to build FAPCOR Nayons in Hawaii, California, Texas, New York, and New Jersey. And that was very successful. And I was funded again to expand it to more states. And so Nevada, I was very, very lucky that Dr. Files took it on, and then like the rest of the team step forward in order to actually build capacity and like form the FAPCOR Nayon in Nevada.
That's awesome. Does the FAPCOR Nayon have anything to do with the Center for Filipino-American Health? That's based out of Texas, right?
Yes, very good questions. I am a professor and director of international programs at the University of Texas Health Science Center at San Antonio. And it was through that funding by PCORI that I was actually able to build the Center for Filipino-American Health. And it's about time, I think. It's like, we need to build our communities in order that they actually know what is important in the community, and we can help each other. I think one of the classic ways to do research is that the researcher kind of thinks like what would be important for me, or like what is lacking in the literature. The PCOR approach actually kind of like switch it back and puts the ownership, the onus of what the research topic would be on the community. And the first question is, what are the issues that you're experiencing? And then later on, we ask like, how do you want to receive the results? And then what is in place in where you are that could address the issues that you are experiencing? And so this is where the leadership of both Dr. Fowles and Elizabeth have been really, really very important, because it's them and the Stakeholder Advisory Council of the Nevada Nayon who would move forward, because I don't know what the resources are in Nevada and Las Vegas.
Right.
Our folks do.
Well, it's so good that this project started in Texas and you decided to expand. You got more funding. That's fantastic, actually. That's great. So the expansion of this project in the different communities is called the Filipino-American Research, or the FAR Hub. Is that correct?
Yeah, that's right. I cannot essentially name the second project the same, right? So I actually named the second project as Filipino-American Research Hub. The key thing here is that other than the expansion to more states, so let me just count the states to you. So we have
how many Nayon networks do you have now?
Yeah, so we are in 12 like named Nayons, but we are actually in 13 states. And let me explain that one, because the New England Nayon actually covers Maine and Massachusetts and like New Hampshire. So they just like put together into one Nayon. So the Filipino-American Research Hub, the FAR Hub, is the goal, other than expansion, is actually to educate Filipinos on what it is like to be part of the research endeavors as full partners of research. Not just a participant, but as full partners, that you have a say of what research will be done to you, and you can decide what would be the research that is important for the community. So that's one of the things that we will be deploying, and we will be having like just research like 101 basically, and also like Filipino specific module where we have invited Filipinos to speak about their experience of having participated in research, because there's a lot of, I guess, lack of like awareness, or lack of I guess, understanding of the importance of why we should participate
In
in
research.
research,
Correct.
especially on issues that are important to us. Like we have a lot, like high rates of diabetes, high rates of hypertension. A lot of our family members have stroke or have died of stroke. So that's really, really very important.
That's great. That's great. Thank you. And according to this, you have a California Nayon, a Hawaii,
Yes.
New Jersey, New York, Maryland, Virginia, Arizona, Georgia, Florida, Ohio, New England, Michigan, and now Nevada. Is that right? Yay! So let's direct the questions to the Nevada people over here.
Okay.
Okay, so the FAPCOR Nayon project is now here in Nevada. So how were you contacted, Dr. Viles?
So it was originally through Dr. J. Tan. I think Dr. Blum had a relationship with Dr. J. Tan, and Dr. J. Tan and Dr. Blum reached out to me and asked if I would take this on. But I always felt that there's this need to address the health issues that are facing our Filipino-Americans in Nevada.
Okay.
And I think the nurses, and I know, not I think, I know that the nurses are the key to addressing this issue.
Correct.
And I think through the Nayon, we will show the state that nurses can lead this beautiful initiative that is upstream, midstream, downstream to help people.
Yeah. Yes, that's wonderful. That's wonderful. And Lisa and Lindsay, so what made you decide to participate in this awesome project? Let's start with you, Lisa.
Well, when Dr. Files approached me with this project, I asked myself, why not? You know, as what she has said, you nurses can lead the way, right?
Correct.
And one of the vital functions of nurses is patient education. We are empowering these patients so then they don't get readmitted to the hospitals. We want them to be healthy. And this is one way where the nurses' patient education comes in to have our PhilAm community live healthier lives and have positive patient care outcomes. So when she approached me, I said, yes, PNA, you know, will support. And then, of course, our whole PNA NV board did say, yes, we will support this project.
Very good. Very good. And how about you, Lindsay? I know you're an educator, right?
Yes. So I was approached by my director, as I was mentioning earlier, who is a good
Hi,
friend.
Rosemary.
Hello, Rosemary. Thank you.
Yes. And so she sent me to meet with Dr. Files, and once I learned more about the Nayon and what it is that she was trying to do and the strides she was trying to make locally here, I said, why not? There has been so many times when I'm like, I should have done this as a nurse, I should have done that, and really honing in on patient education. Most of the time, a lot of people in our community, they will just say yes and agree with everything that someone of like a nurse or a doctor will tell them. But once they go home, really, what do they do with that information?
Right,
And I can
right.
personally relate to that with having many relatives have gone through different levels of the healthcare system and seeing those barriers. And I feel like this is time for not just me as a nurse, but as a Filipina to hold myself accountable and do my part to give back. So I'm super passionate about everything that we're trying to do.
And if I may
Awesome.
just add to that, part of my training back home in the Philippines, you know, as what they call us iska, because the state or the country did send us to school. So our role is to really give back and serve our people. And so
Right.
this was a great opportunity for me to
Absolutely.
give back.
That's really pretty awesome. So
Absolutely beautiful. And Doris, I'm just from the meetings with the stakeholders and meetings with the Filipino-Americans who participated in our meetings, we saw that there's chronic diseases and mental health as a big issue.
yes.
So
yes.
together, when we did our stakeholders meeting, we said, no, so we're going to approach this from primary prevention. In other words, we want to deal with how do we really prevent people from getting this
Right,
in the
right.
first place?
Right.
Two, how do we help people who now have it?
Mm-hmm,
And then how do we help people manage
Right.
recovery?
Right.
So we want to tackle the whole gamut so that we really address the needs of Filipino Americans in terms of prevention, management and treatment of chronic diseases, as
right.
well as supporting them in their continuous recovery.
Okay, so it looks like the leadership of this project are healthcare workers, nurses. Okay, and I know that you had engaged also the different community leaders and you made them stakeholders, right? So who are these stakeholders? I think, let's see.
You mean stakeholders?
Stakeholders,
Advisory Council?
the advisory council, right?
Yes.
Do you have those?
Yes, actually, it's very important, not just for us to be doing it all, right? It can't succeed because we have to engage our community. So we have our PhilAm community leaders out there as stakeholders. We're actually forming this consortium, and we have invited, leaders from NAFA, FASAI, PAAN, UPAAN, all these community organizations that are out there serving in their own rights in our community here in Nevada. And so we are tapping into their resources as well because they will be very essential, when we have all these projects and all these programs that involves our Filipino community because they're the ones out there, right?
Correct,
when they
right.
conduct consular outreaches, who's out there? It's these organizations. When we have these food drives, etc., they're out there too. They're owners of healthcare services like the adult daycares. They have these primary care clinics and specialty. Everybody is involved. So we are inviting them all to join our consortium.
That's great. And the Stakeholders Advisory Council, I think I have a list here. We have Ms. Gloria Kawili, Jessica Lilang, Jacqueline De Hoya, who is from NAFA, Mr. Bernie Benito, who does not know Bernie here in the community, Dr. Flora Saison, of course, our current PNANV president, Mr. Johan Saison, the media person here and owner of PHLV Radio, and Dorothy Lenore Dot,
Yes.
right? And
From UPAAN.
Dr. Michael Sanawana, who represents the teachers. Is that right?
Yes.
Okay.
And many more.
And many
But
more.
For right now, that is the SAC, or the Stakeholders Advisory. Yes.
Okay, wonderful, wonderful. So chime in anytime, Dr. Bloom, okay? So what are the goals
I would
of
just
the
like to, if I may chime in, I would just like to really say, like, my thanks to the leaders, because they are doing, like, what they're really doing is building this capacity for the community to be together. And it was a little bit like they are latecomers in the game because of illnesses and so on and so forth. But they stepped up and they were like in such a short of time, and you could see like at the meetings how engaged they are, and really I'm super proud of them and thank them from the bottom of my heart.
Well,
You're
that's
welcome.
good. Thank you. You're welcome. Thank you for leading this, actually. So what are the goals of the Nayon project, and what are the issues that you have identified here in Nevada?
So we got our slides from our presentation, but in a nutshell, it's chronic physical, mental, emotional, and spiritual diseases. So there was such a huge emphasis on mental disorders,
Right.
and as we all know, it's a chronic brain disease. So we're like, okay, when we started to try to address this from a primary, secondary, and tertiary prevention, we said, well, a lot of the things that apply to prevention of diabetes applies to prevention of mental health disorders. And
So they're interrelated.
wow,
You're
yes,
right.
Yes, so that's what we have found in our several meetings, right? Elizabeth and Lindsay?
Yes.
That's what we have found. And also, the wonderful things we've found is that people know the resources, internal and external resources that can be mustered, synergized among us to address these issues. So, based on the first question, Lindsay, do you want to take that
it's
on?
a health and healthcare related
Yeah.
issues.
What's your take on that?
Yeah, and I will definitely support everything that Dr. Fildes was mentioning with chronic diseases. I'm sure everyone in the Philam community knows someone, if it's not them, that has diabetes or cardiovascular disease. They know someone personally that is suffering through these conditions.
Right.
In addition to mental health awareness, there is such a stigma. Some misconceptions of being able to talk about how they feel even about diabetes or other diseases like that. It's like, oh, it's going to be okay. You just take your meds and that's it. But really, how do the individuals feel about having something like this?
Right.
And I feel like a lot of times the barrier is knowledge and access to care. As we were saying, they partner up with so many different organizations who are ready to help our community, but our community isn't really aware to reach
Right.
out,
Yeah.
right?
And one thing that I wanted to emphasize on that as well, aside from the knowledge deficit or access, there's also, as what she mentioned about stigma, when you have your core cultural traits as well as attitudes that can get in the way because they're like, oh, nahiya ako humingi ng tulong and all that.
Yes.
So we also need to be cognizant of these barriers.
The barriers
Yes.
to good quality care is what you're also looking for, and how you're going to address that, right?
Right. And especially we talked about mental health, no? It's such nakakahiya kind of
Yes.
feeling.
There's always a stigma.
culturally. Itago mo yan, walang makakaalam nito sa labas ng ating pamilya, right?
Right,
So
right.
how does that person really feel? So there's a lot of work on everyone's part to destigmatize mental health and
mental
substance
illness.
use
Right.
disorder. Yeah.
Right,
So just an FYI, this is very interesting. There was a Filipino public health person who did this work, surveyed Filipino-Americans,
Dr. C.
C.
Oh, yeah.
Right.
Francis
And
C., right?
Yes. And that was 2018 research, right? And we looked at what we found from our stakeholders meeting, and lo and behold, it's the same. Pareho.
I think
Still
I
the
participated
same.
in that one.
Still
Yeah.
the same. So really, it's just pressing. We need to address this. We need to get together. I remember in one of our stakeholders meetings, somebody said, "Oh, isn't that what Dr. C found in 2018? What happened, right? What
Right,
happened?
right.
Anong
What
ginawa natin? Wala, right?
Wala.
Wala. So now this is our opportunity to
Very
do
good, very
something
good. So
together.
essentially,
If I may
what-
add as well,
go ahead.
one of the things that I have done before I actually, when I submitted my first FICORI grant, was to look at the literature among Filipinos. As I mentioned, we are almost always lumped with Asians, but this like substance abuse was there, hypertension, diabetes. What I've noticed is that through the years, this was like early 2000 or like 2010 or something like that. So there was about 10 literature from 10 years ago. What is happening is that it is actually worsening. So before they reported rates of about 25%. That was early 2000, 2010 period. About 2015 in literature, it was about 50 to 60%. And then our more recent data, it's about 70%. So it's not getting better. And I think it's because nothing has been done. I think you hit the nail right on the head in that there's nothing to be done. And I think we can only do so much. I think Liz was mentioning earlier about, we can do so much as healthcare practitioners, but the community, the patient has to take ownership in making themselves be more healthy.
Yes.
So I think that's an important point.
Yes, and so you hit all of these different important points, which is also one of the things that I think one of your projects is to find out who are the facilitators of good quality care, and more importantly, how to engage the Filipino community. Is that correct?
Yeah. Yes.
Do you have an opinion
What was
on that?
the outcome of that question? Do you have that, Lisa? So many people have said.
So how would you do or engage the Filipino community?
So we discussed a lot of great ideas with social events for sure. As a culture, we love to get together. And so that would be a really great approach with reaching out and seeing, really just talking to people and seeing what it is the needs are.
What their needs are.
Yeah, social events, online platforms, we're getting that up and running since this is the digital age, of course, it's Facebook, Instagram, TikTok, we were mentioning that as well, just to appeal to different, appealing to different age ranges even, right? School and public speaking events. I'm not too sure who we talked to the last time.
Mark Domingo.
Oh, yes. Yeah, Mark Domingo. Yes, he's over there at Dignity Health, and he's a great resource as well with holding public classes for free or to even like a little fee, a small fee to attend these type of prevention classes. So at the church.
Yes.
We mentioned that
Churches,
as well.
yes, that's very important.
Monthly health screenings and providing educational materials that our community can easily understand, not just in English, but in their language, right? Yeah.
Yes, and the other thing too that I wanted to emphasize on that, we're trying to meet our kababayans where they are at, right? So we're going to be there whenever there is an event or whatnot, but we do have other partners that are willing to even share what resources they have, kind of like Humana. They already have cooking classes. They have all these educational opportunities, that would make our kababayans healthy. Same thing as what she said about Dignity holding these classes. So tapping into all these resources and not reinventing the wheel, but having them participate in this program because they already have established, activities. So
and how exciting! How exciting! Now, Dr. Blum hasn't heard about this, but this is very exciting. I reached out to Dignity, Common Spirit, and lo and behold, the network area manager is Filipino-American.
Oh my goodness gracious.
Wow.
Yeah.
And so their classes, they have 3 Filipino-American educators there.
Yes.
So we met last week. We're brainstorming on how I believe we've already agreed to co-partner, co-brand the promotion of existing chronic disease prevention programs, chronic diabetes management programs, heart disease. In fact, even Medicare, understanding Medicare,
Yes.
they already have it. And then they have lifestyle coaches, and they
Wow.
can train Filipino-Americans at no cost
Yes.
to become lifestyle coaches. And so we were all so excited about it. So, and also, Elizabeth talked about creating a hub,
Yes.
right? So that I remember when I was doing promotion for the Nevada Tobacco Users Helpline, it's very important that the referral is made simple so that the patients are directed to,
Correct.
or people are directed to one source. So that's one of the things we're exploring. But also, we don't want to forget that Filipino-Americans, just like everyone, I believe, we think about problem behavior change when we're sick, unfortunately, right?
Yes, of
so
course.
physicians, Filipino-American physicians, are partners here. And so many of them have already said, yes, I'm in, and all that stuff. So we're thinking screening, brief intervention and referral to treatment, including screening for social determinants of health.
That's
their
good.
needs for pera or transportation
Right, right.
to go to, or insurance, all that stuff, which are barriers to health.
To health, right?
Yeah.
Okay.
And we're also creating this like little flyers, that would promote, the resources, where they can get the resources.
Correct,
And
correct.
believe you, when I was so excited after joining the FAPCOR Nayon that we do have the Nevada 211 here. And when I was scrolling and playing with it on the website, there's actually an option to get these resources and instructions in Tagalog, in Filipino. And little did I know that until I was researching on this. So again, there's these resources. If I didn't know about it, would the other
I
people
don't know anything. That is correct.
We're
That's
creating
correct.
these flyers to say, okay, let's maximize Nevada 211, and then give like little instructions on how they can navigate the Filipino page. And then aside from that, we are also creating an adjunct or a supplement, where we have all these PhilAm providers, that can help them, because sometimes it's easier to relate with somebody that understands your language and can pace whatever instructions that they're giving you and whatnot. So as an adjunct to Nevada 211, we will have our own telephone teletulong directory. where
I
we
love
have the
that.
Filipino
Teletulong.
providers.
I love that. Yes, teletulong.
So yes,
All right.
yes. So we're really just very excited, putting all these resources where it's easy to reach. It's easily accessible to them. Oh, I need this. Oh, I go to my teletulong directory. Something like that.
So it looks like, you guys are already on point. You have identified the major health priority issues here in Nevada, which is pretty much hypertension, cardiovascular diseases, mental health issues, diabetes. Okay, so, and you are conducting your research how? How are you conducting that? By talking to people, or?
That's our initial way of finding out what the concerns are of the
Right.
community. So that's based on the work of Dr. Dana Blum. So we followed her direction in terms of meeting people. We conducted 3 meetings and then 1 stakeholders meeting. And now we conducted a I don't want to call it strategic planning, but creating an action plan for what we're going to do in
Yes.
2023 and 2024. And then that includes a partnership with Dignity and Common Spirit. And then 211.
Yes.
Nevada
And
211.
we're I'm in touch with some grant writers who are looking for funding sources. So that's what we're doing. And I think that that Dr. Blum mentioned the orientation to participation, active participation in research, and we'll bring that to our programming for Filipino Americans here in Nevada. But I think it's so important that people see first ano ang serbisyo
Yeah, that's-
na
yes.
ibibigay mo sa akin
How-
bago ako participate dyan. Di ba? Di ba? We need to
What's
have.
in it for me?
What's in it for me?
Okay.
Thank you.
Exactly.
And that relationship is so important, and I think that will come.
Right.
That
It will come. So primarily you guys are still in the organizational state, but you are already, getting out there. So I am going to hold you guys accountable to come over here and actually update what your activities are.
Yeah.
We will be here.
Yes, of course. And so how are you going to disseminate the results of your research?
Well, nowadays, because everybody into social media, right? So Lindsay mentioned earlier, we have these different platforms, the IG, Facebook, and then of course all the other results, they can go through emails, text messages, as well as we're reporting to our community leaders, and then they will disseminate it to their membership as well. And then we do have a collaboration with all these Filipino organizations whenever, like for example, with NAFA, they have like monthly meetings, and we're planning not to invade, but be a guest during their meeting and promote this Nevada Nayon, right? And whatever opportunities we have. And then in festivals, like for example, come June, we're celebrating our Independence Day.
Yeah.
And then we, in October, we also have our, the Filipino Heritage Month. So we are taking all these opportunities out there that are available to us. But also, not to forget, we have, contacts from all the journals, newspapers and whatnot. And we do have stakeholders as well that are connected with the mainstream TV, and we have these podcasts, all these hosts and whatnot, as well as our columnists, Kuya Sol and Julie, and they can help us out.
With
So,
local newspapers, right? Yeah.
In addition to what Lisa talked about, I think it's very important that we're clear about what outcomes we want to track.
Right.
So here's the good news. Our partners at Dignity are funded programs, okay, that have outcomes to be met. So
Nice.
our partnerships, whatever we offer to the Filipino-American community, we will track utilization, we will track how did you benefit from that information, who did you share that with, etc. So we are going to be careful to ensure that we track our outcomes, and then we'll report it to all these different media.
Right.
And then we come back to you.
Of course, of
Yes,
course.
and if I may add, all the information and resources will also be available in the Center for Filipino-American Health, specifically on the link for Nevada, so that it becomes a one-stop shop for folks who may want some information. And the other aim for the Filipino-American Research Hub is to actually also promote or provide information for research studies that might be recruiting Filipinos or Asians, so that there's representation, and individuals who would have like issues, for example, if there are research for diabetes, they will be able to avail of those opportunities through our website. So those are, and not to be also missed is professional, really manuscript development and having it published in a journal, a peer-reviewed journal, because that could potentially actually bring us more monies as in grant mechanisms through the National Institutes of Health and other funding opportunities, because they count like peer-reviewed journal articles as in their consideration in their reviews for funding opportunities.
Yes.
Doris, if I may just add, I don't want to miss out on this, on how we disseminate our results, right? What is the best way to really promote what we are doing right now is through word of mouth.
Exactly.
Who would best hear us? Would be our families, the people that are at our work, as well as church, people that we interact with on a day-to-day basis. Sometimes a referral would be better than reading like an advertisement, rather than having somebody, oh, this doctor so and so really treated my mom well, he's really good, you can trust him. So it's word of mouth.
The
really.
Filipino grapevine.
Yes.
And if I may add to that one, we had once, like in Texas, we had a participant who were 3 generations. So the adult, the mom, and the grandchild were participating in the focus groups, and the adult was sharing, like, my mom, she's 90 years old, she's always on Facebook, and so if like if her friends are doing it, they're like, she's more likely to do it. So I think that's really true what Lisa was sharing.
Fantastic.
Beautiful.
And I actually checked out your website. So if you want to go and look up FAPCOR, FAPCOR, you will come up with that website for the Centers for Filipino-American Research. And part of the headings there is the FAR Hub, wherein it will direct you to the different networks of the different states. And so you can look up your own particular state in the different activities that they are actually doing with this Nayon project, right?
And
Yes.
Doris, may I add
Sure.
to the nurses who are listening to you now. So please come and help us.
Yes.
Right?
Yes.
In whatever way you can. Micro volunteering, whatever you can do. Whatever you can do,
yeah.
come and help us.
That's right. That's right. Well, okay. So, what are your final thoughts, ladies? What is your message to the public and to the Filipino-American community regarding the Nayon project?
Well, to the nurses, right? Come and help us and be informed of the resources that we're going to come up with. Right? That's true. And to the other healthcare professionals who are listening to you. Share with us what you know so that we can put them all together.
Yes, yes. And
Lisa?
Elizabeth, what's your final thoughts on this?
So I'm gonna speak to everybody in Filipino. Maraming salamat po sa ating mga kababayan, mga PhilAm organizations na tumutulong para itayo itong FAPCOR Nevada Nayon. Pag nagkakaisa tayo, kapit-bisig, kapit-kamay, para sa tagumpay ng FAPCOR Nayon.
Wow, I love that. Kapit,
love it.
bisig,
I love
kapit, kamay, para sa Nayon. Is that
Para
right?
sa tagumpay.
Para sa tagumpay
I
ng
love
I love that. Let's make a t-shirt on that. Yeah.
That's our motto.
Thank you, Lisa, for that. And how about you, Lindsay?
Yes. Well, again, I think the time is now to not just our fellow Filipino-American nurses, just as a community, the time is now to help each other out. It really is a ripple effect. Even if this initiative will start small, the more passionate supporters we have in doing these things and being the bridge between our community and the resources that are already there is truly going to be a big testament to how much we really care about one another. So I think, like I said, the time is now, and let's all hold ourselves accountable to give back.
Yay.
And then lastly, to the Filipino-Americans who are in the community na nanghihina o nangangailangan ng tulong, wag pong mag-hesitate, wag magdalawang isip na humingi ng tulong.
That's right.
Kasi po, kung meron kayong tulong, it emboldens you to be better. Right?
Right.
So kakayanin po ito together.
We're in this all together. Yes. And Dr. Blum, what do you have last words for you?
Very, very nice. I go with everyone as well as Lisa's. I love it. Like together we can. Kaya natin to. We are all in this together, and we can make each other healthier for better outcomes in our community. Health is wealth. So sometimes we focus on the wealth side, but not on the health. But really, health is wealth.
Right.
Beautiful.
Very good. Beautiful. Well, ladies, thank you very much for joining us today and sharing this information about FAPCOR Nation. And for more information on FAPCOR Nation, you can call any one of you. No, it's just
Thank you, Doris.
Please reach out.
Thank you so much. Thank you.
Thank you. Please
Bye-bye.
reach out
Thank
to
you.
please reach out to fil.am.pcor@gmail.com. Is that correct? Yeah.
Yes, that's right. Thank you so
Okay,
much.
we'll have that on screen for everybody. And so, thank you again, ladies.
Salamat.
Okay. And
Maraming salamat po.
Yes. And thank you, Dr. Bloom. And so to the FILPINARS audience, remember that the Filipino-Americans are the fastest growing minority group here in our community and in many other communities. Now, Filipinos have filled up labor shortage personnel in many fields, and especially in healthcare and nursing. But these people and the ones around them need to stay healthy. But we still see the prevalence of chronic diseases like diabetes, hypertension, cardiovascular diseases, and even mental illness. So FAPCOR Nayon, with its research and dissemination of patient-centered outcomes, is helping the community to handle these issues. Please show them your support. Thank you very much again for joining us today. Thank you for the privilege of your time. This is Doris Bauer, your FILPINARS host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you FILPINARS, news and features about the Filipino-American nursing community and beyond. Fridays, 7 p.m. on PHLV Radio.